going to study cardiac conduction system and nerve supply. The learning objectives of today's lecture are: by the end of this lecture, student will be able to describe the conducting system of heart, explain the different components of conducting system, to discuss the blood supply of conducting system, and to discuss the innervation of heart. So the first part is cardiac conducting system. The normal heart, which contracts rhythmically at about 70 beats per minute in the resting adult. This property of the heart is because of the musculature of the atria and ventricles, which is capable of contracting spontaneously. Now, this contraction occurs as a result of cardiac conduction system, which initiates and coordinates the contraction. Now, the cardiac conduction system consists of nodes and a network of specialized myocardial cells, which are organized into four basic components. The first is SA node, the sinoatrial node. The second is AV node, the atrioventricular node. Then the atrioventricular bundle, which is also called as bundle of His, with right and left bundle branches. And the fourth component of the cardiac conduction system is the subendocardial plexus of conduction cells, which are also called as Purkinje fibers. So you have to remember that there are four components of the cardiac conduction system: SA node, AV node, AV bundle with right and left bundle branches, and finally the last component of the conducting system is the Purkinje fibers. So we will discuss the components one by one. The first is SA node, which is also called as cardiac pacemaker. This is SA node, which is called as cardiac pacemaker. Now the impulses begin at the SA node. Now this is basically the collection of cells which is located deep to the epicardium. Now there are three layers of heart: epicardium, middle one is myocardium, and the inner one is endocardium. Now this SA node is located deep or beneath the epicardium at the superior end of the crista terminalis, and at the junction of superior vena cava and the right atrium. So for location, you have to remember 3 points. The first is that it is located deep to the epicardium. Second point is that it is located at the superior end of the crista terminalis. And the third and the most important point is that it is located at the junction of the superior vena cava and the right atrium. Or we can say it is present at the point where the superior vena cava opens into the right atrium. So this all is about the location of the SA node. It is located deep to the epicardium at the upper end of crista terminalis, and it is located at the junction of superior vena cava and the right atrium. Now look at the first picture, which is showing the layers. The outer one is epicardium, then this is epicardium, then middle one is myocardium, and this last one is endocardium. This is the second picture which is showing the crista terminalis. Now this is crista terminalis and the SA node is located at this level. Above the crista terminalis, this is crista terminalis. So the SA node is located beneath the epicardium at the upper end of crista terminalis, or we can say it is located at the junction of superior vena cava and the right atrium, or we can say where the superior vena cava opens into the right atrium. As we have discussed that the impulses begin at the SA node. Now these excitation signals which are generated by the SA node spread across the atria, causing the muscles to contract. Now this SA node is stimulated by sympathetic division of the autonomic nervous system, which increases the heart rate and force of contraction, and it is inhibited by parasympathetic division, which decreases heart rate. Now the second component is the atrioventricular node, or the AV node. Now the wave of excitations in the atria now stimulates the AV node, which is located in the posterior inferior region of interatrial septum, near the opening of coronary sinus, close to the attachment of septal cusp of the tricuspid valve. Now again, for location of AV node you have to remember 3 points. The first is that it is located in the lower or the inferior part of the interatrial septum. So the first is it is located in the lower part of interatrial septum, near the opening of coronary sinus and above the attachment of septal cusp of tricuspid valve. Now this is the location of the AV node. Where it is located? In the inferior or the lower part of the interatrial septum. This is coronary sinus, near the opening of coronary sinus, above the attachment of septal cusp of tricuspid valve. Now these are the points which are commonly asked in BCQs. Now look at this picture. This part is showing interatrial septum. This is the opening of coronary sinus and the septal cusp of tricuspid valve. So they are located at this level. Above the attachment of septal cusp of tricuspid valve, in the lower part of interatrial septum and near the opening of coronary sinus. So this is about the location of the AV node. Now as we have discussed the location, that it is located in the lower part of atrial septum, near the opening of coronary sinus. Now the signals, the second point is that AV node distributes signal to the ventricles through AV bundle. Now the signals which are generated by the SA node passes through the wall of right atrium, propagated by cardiac muscle, which transmit the signal rapidly from the SA node to AV node. Now the signals which are generated by the SA node transmit to the AV node by the wall of the, or the muscles which are present in the wall of the right atrium. Now this AV node then distribute the signal to the ventricles through the AV bundle. Now these are again speed up, or the sympathetic stimulation speed up conduction, and parasympathetic stimulation slows it down. Now the third component is AV bundle. The AV bundle is the bridge between the atrial and ventricular myocardium. It is the only pathway of cardiac muscle that connect the myocardium of atria and the myocardium of the ventricles, and it is the only route along which the cardiac impulses can travel from the atria to the ventricles. So the cardiac impulses from the atria to the ventricle passes through the atrioventricular bundle. This AV bundle passes from the AV node through the fibrous skeleton of the heart and along the membranous part of interventricular septum. Now for the location of atrioventricular bundle, you have to remember that it passes through the fibrous skeleton of heart. Now look at this picture. This is the fibrous skeleton of heart. This whole blue colored is the fibrous skeleton of the heart, and this is the location of the atrioventricular bundle, which passes, or we are saying that it passes through the fibrous skeleton of the heart. Second, we are saying that it is present in the membranous part of the interventricular septum. We have already studied that the interventricular septum has two parts. The upper part is membranous. Look at this picture. This is the interventricular septum, membranous part, and this is the muscular part. So the interventricular septum has two parts. The upper part is membranous and the lower part is muscular. Now this AV bundle is present in the membranous, or the upper part of the interventricular septum. It passes through the fibrous skeleton, and we can say it runs through the membranous part of the interventricular septum. At the junction of membranous and muscular parts, it divides into right and left bundle branches. These branches proceed on each side of muscular interventricular septum and deep to the endocardium. Now the AV bundle runs along the membranous part, which is the upper part of the interventricular septum. We have discussed that at the junction of membranous and muscular part, it divides into right and left bundle branches. Now the right and left bundle branches run along which part of the interventricular septum? The lower part, the muscular part. So the AV bundle divides into right and left bundle branches. So they run on each side of the muscular part of the interventricular septum and deep to the endocardium. Now again we have to remember this point, that they are present deep to the endocardium. These branches now run on each side of the muscular interventricular septum, and then they ramify into the subendocardial plexus or the subendocardial branches, which are also called as Purkinje fibers. Now come to this picture again. It is a bridge between the atrial and ventricular myocardium, and this AV bundle is responsible to transmit impulse from the atria to the ventricle. Second is, it is direct continuation of the AV node. Look at the picture. This is AV node. This is AV bundle, which is also called as bundle of his. So this AV bundle is direct continuation of the AV node. Passes through fibrous skeleton in a long membranous part of interventricular septum. This is the membranous part. At the junction of membranous and muscular part, it divides into right and left bundle branches which run on each side of muscular part of interventricular septum. AV node runs along the membranous part of the interventricular septum. AV bundle runs along the membranous part of interventricular septum, whereas right and left bundle branches, which are the branches of AV bundle, they run on in the muscular part of the interventricular septum. Now what is written? At the junction of membranous and muscular part of interventricular septum, it divides into right and left bundle branches. Now come to the right bundle branch. The right bundle branch continue on the right side of the interventricular septum. Which part? Muscular part, towards the apex of the right ventricle. Now these right bundle branches, they enter the septomarginal trabeculae to reach the base of anterior papillary muscle. Now look at this picture. This is SA node, then AV node, then AV bundle, then right bundle branch. Now look at the picture. The right bundle branch passes or enters through the septomarginal trabeculae to reach the anterior papillary muscle. This is septomarginal trabeculae and this is anterior papillary muscle. So you have to remember that the right bundle branch arises from AV bundle at the junction of membranous and muscular part of the interventricular septum. Now the right bundle branch runs on the right side of the muscular part of interventricular septum up to the apex of the right ventricle. But these right bundle branches also passes through the septomarginal trabeculae to reach at the anterior papillary muscle, where it divides into branches. Now look at the picture where this is single right bundle branch, but when it reach at the anterior papillary muscle by passing through the septomarginal trabeculae, then it divides into branches which become continuous with the Purkinje fibers. Clear? So it continues on the right side of the interventricular septum toward the apex of the right ventricle. It then divides and is continuous with the final component of the cardiac conduction system, that is Purkinje fibers, after passing through the septomarginal trabeculae to reach at the anterior papillary muscle. Then they divide and continuous with the Purkinje fibers. Now this right bundle branch stimulate the muscles of interventricular septum, anterior papillary muscle and the wall of the right ventricle. Then the left bundle branch, which passes to the left side of the muscular interventricular septum. Look at the picture. This is left side, left bundle branch which passes through the left side of the muscular interventricular septum towards the apex of the left ventricle. It gives off multiple branches which become continuous with the Purkinje fibers, which are also called as subendocardial plexus of conduction cells. Now these left bundle branch spreads the excitation impulses throughout the ventricle, means again the interventricular septum, wall of the left ventricle, as well as anterior and posterior papillary muscle. Now this branch supplies both the anterior and posterior papillary muscles. The final component of the cardiac conduction system are the Purkinje fibers. These are the Purkinje fibers. These are the network of specialized cells which are located in the subendocardial surface of ventricular walls. It is located in the wall of ventricle and it transmits the cardiac impulses from AV bundle to the myocardium of ventricles. Now come to the arterial supply of conducting system. The SA node is supplied mainly by the branches of right coronary artery. In 60% of individuals, the SA node is supplied by branch of right coronary artery, but in about 40% of individuals, it is supplied by left coronary artery. Then the second component is the AV node and AV bundle. This is SA node, which is supplied by right coronary artery, in some people by left coronary artery. Then AV node and AV bundle. This is AV node, this is AV bundle, which is direct continuation of the AV node. So both these two components are supplied by right coronary artery. This is right coronary artery. So this right coronary artery supplies the AV node as well as it supplies the AV bundle. Then right bundle branch is supplied by left coronary artery. Now look at this picture. This is right bundle branch, but it is supplied by left coronary artery. Look at the picture. These are the branches of left coronary artery which are supplying the right bundle branch. Now look at the left bundle branch. This is left bundle branch and this is supplied by both the branches of right coronary artery and left coronary artery. Now look at these are the branches of right coronary artery which are supplying to left bundle branch, and these are the branches of left coronary artery which are also supplying the left bundle branch. So SA node is simply supplied by right coronary artery in about 60%, and in some individuals, means in about 40%, it is supplied by left coronary artery. Then AV node and the AV bundle. The AV node and AV bundle are supplied by right coronary artery. Then the right bundle branch is supplied by left coronary artery. Look at the pictures. The branches of left coronary artery are supplying the right bundle branch, whereas the left bundle branch is supplied by the branches of both the right and left coronary artery. Now ischemia of any of the branch or the arteries supplying the conducting system produces disturbances in cardiac muscle contraction, which results in heart block. Now the second part of today's lecture is nerve supply or the cardiac innervation. Now the heart is innervated by sympathetic and parasympathetic division of autonomic nervous system via cardiac plexus, which is situated below the arch of aorta. The sympathetic supply arises from the cervical and upper thoracic portion of sympathetic trunk, and the parasympathetic fibers comes from the vagus nerve. In addition to this, there is the presence of visceral efferent fibers which are conveying reflexive and nociceptive fibers from the heart. Now these divisions, both the sympathetic and parasympathetic divisions of autonomic division of the parasympathetic nervous system, are responsible for regulating heart rate, force of each contraction and cardiac output. And the sympathetic and parasympathetic division supply the heart through the cardiac plexus, which is situated below the arch of aorta. Now this cardiac plexus has superficial part and the deep part. You have to remember the location of superficial and deep part. Now this is the first picture which is showing the superficial part of the cardiac plexus. This is the superficial part which is located below the arch of aorta. This is arch of aorta. So simply we can say that the superficial part is present below the arch of aorta, or we can say it is present between the arch of aorta and the pulmonary trunk. So the superficial part is present below the arch of aorta, or it is present between the arch of aorta and the pulmonary trunk. Both points are same. Now the deep part. Again for the deep part, you have to remember that it is present at the level of, this is the second picture which is showing the deep part of the cardiac plexus. Now again for the deep part, you have to remember that the deep part is present at the level of bifurcation of trachea, or we can say it is present between the aortic arch and the tracheal bifurcation. Now look at the first picture again. This is aortic arch, and behind the aortic arch there is the presence of bifurcation of trachea. So it is present at the level of bifurcation of trachea, but more specifically we will say that it is present between the arch of aorta and the tracheal bifurcation. Arch of aorta is anteriorly placed and the trachea is posteriorly placed. So this deep part is sandwiched between the arch of aorta and the tracheal bifurcation. Now come to the sympathetic innervation. The stimulation of sympathetic system increases heart rate and force of contraction. Now look at this picture. The first is about the preganglionic fibers. The preganglionic sympathetic fibers, look at the picture, this part. The preganglionic fibers arises from upper 4 to 5 segments of thoracic spinal cord. 1, 2, 3, 4. Now the green lines which are present below these arrows are the preganglionic sympathetic fibers. Look at the picture carefully. These green lines which are present below these 4 arrows are the preganglionic fibers which arises from upper 4 to 5 segments of thoracic spinal cord. These preganglionic fibers enter into the sympathetic trunk, which is present on the sides of the spinal cord. This is spinal cord. The preganglionic fibers arises from the spinal cord. From which segment? upper 4 or 5 thoracic segments of the spinal cord. These preganglionic fibers enter into the sympathetic trunk or the sympathetic chain, which is present on each side of the spinal cord. Now, when they enter into the sympathetic chain, these preganglionic fibers, when enter, they also move into the upward direction, means into the cervical region. This is the cervical region. Now, what you have to remember, that the preganglionic fibers arises only from upper 4 to 5 segments of thoracic spinal cord. Look at the picture. No preganglionic fibers arises from the cervical segment. The preganglionic fibers arises only from the thoracic segment. But when these preganglionic fibers enter into the sympathetic trunk, they then also move upward in the cervical region, or we can say they synapse in both the cervical and the thoracic region of the sympathetic trunk. After synapsing in the cervical and thoracic region of the sympathetic chain, now the postganglionic fibers arise. Now look at the picture. The postganglionic fibers arises from both the cervical and upper thoracic segment of the upper thoracic segment of the sympathetic trunk. Clear? First, the preganglionic fibers. Look at this part. The preganglionic fibers arises only from the thoracic upper 4 or 5 thoracic segments of the spinal cord. These preganglionic fibers do not arise from the cervical segment, they arise only from the thoracic segment. They enter into the sympathetic trunk and where they synapse. Now inside the sympathetic trunk, some fibers moves in the upward direction, means in the cervical region. So the synapses occur both in the cervical and thoracic region of sympathetic trunk, sympathetic chain. Now the postganglionic fibers arises from both the cervical segment and the thoracic segment of the sympathetic chain. Now these postganglionic fibers then innervate the heart through the cardiac nerves. These are called as cardiac nerves. Now what is written? The preganglionic sympathetic fibers arises from upper 4 or 5 segments of the thoracic spinal cord. They enter and move through the sympathetic trunk. They then synapse in cervical and upper thoracic sympathetic chain or the sympathetic ganglia. The postganglionic fibers proceed from the sympathetic trunk, from cervical and thoracic portion of the sympathetic trunk to the cardiac plexus. Now the parasympathetic innervation. This blue line is showing the parasympathetic innervation. This whole green colored lines are showing the sympathetic innervation. This blue colored line is showing the parasympathetic innervation. Now the stimulation of the parasympathetic system decreases heart rate, reduces force of contraction and constructs the coronary arteries. Now the preganglionic parasympathetic fibers reach the heart as cardiac branches from the right and left vagus nerve. These are the parasympathetic fibers. preganglionic fibers. No synapse occurs in the mid portion. The preganglionic fibers arises from this part of the brain, that is medulla. The preganglionic fibers run through the vagus nerve to the heart or to the cardiac plexus. So the preganglionic parasympathetic fibers reach the heart as cardiac branches. This is the right vagus nerve, on the other side left vagus nerve. So on each side, they are present on each side. Now these are the preganglionic fibers. This one, this is preganglionic fibers. Preganglionic fibers which reach the heart as cardiac branches from the vagus nerve, or simply we can say that the preganglionic fibers reach the heart as the vagus nerve or as the cardiac branches of right and left vagus nerve. On the heart there is the presence of cardiac plexus. So they enter in the cardiac plexus and synapse over there. They synapse in the ganglia, which is located either within the plexus or in the wall of the atrium. So the synapses of these preganglionic fibers occur on the wall of the atria or within the cardiac plexus. The third are visceral efferent fibers. As we have discussed, these are also the components of cardiac plexus. From the cardiac plexus, some other visceral efferent fibers also arise. Now these fibers, we have discussed that they convey reflexive and nociceptive fibers from the heart. These fibers passes to the central nervous system. Visceral efferent fibers, they arise. Simply you have to remember that there are also some visceral efferent fibers for conveying reflexive and nociceptive information. Now these visceral efferent fibers passes from the heart, means passes from the cardiac plexus towards the central nervous system. These visceral efferent fibers passes from the heart or from the cardiac plexus of the heart towards the central nervous system. Clear? Now these cardiac nerves reach the central nervous system. From the cardiac plexus, the fibers, the visceral efferent fibers which arises that reach to the central nervous system are named as cardiac nerves. So these cardiac nerves from the cardiac plexus towards the central nervous system follows two pathways. They either reach the central nervous system through the vagus nerve, or they reach the central nervous system through the sympathetic trunk. So it is written that these fibers pass through the cardiac plexus, or you can say from the cardiac plexus to the central nervous system in the cardiac nerves. But these cardiac nerves reaches towards the central nervous system through the sympathetic trunk or through the vagal branches. Now the efferents associated with the vagal cardiac nerves return to the vagus nerve. From the cardiac plexus, the fibers which arise, these fibers which are marked by this black circle, these fibers which emerge or which arises from the cardiac plexus are called as, simply they are called as cardiac nerves. These cardiac nerves may reach up to the vagus nerve and to the sympathetic trunk. Now the cardiac nerves which reach or which enter the vagus nerve are called as vagal cardiac nerves, and those which passes to the sympathetic trunk, they are called as cardiac nerves of the sympathetic trunk. Now the efferents associated with the vagal cardiac nerves return to the vagus nerve, and these fibers are mainly associated with the cardiac reflexes. Now, what do you mean by cardiac reflexes? Now, the cardiac reflexes are basically the fast acting reflex loops which are present between the cardiovascular system and the central nervous system. Now, these cardiac reflexes contribute to the maintenance of cardiovascular homeostasis, heart and blood vessels. So, these cardiac reflexes are mainly responsible to maintain the homeostasis of cardiovascular system. So, these visceral efferent fibers which reach the CNS through the cardiac nerves. Now these fibers sense alteration in blood pressure and blood chemistry, and so these fibers are mainly responsible for cardiac reflexes, or they are mainly concerned with the cardiac reflexes. Now some efferent fibers reach the central nervous system through the sympathetic trunk. So the efferents associated with the cardiac nerves from the sympathetic trunk reach to the cervical or thoracic portion of the sympathetic trunk, then towards the central nervous system. Now these fibers conduct pain sensation from the heart. Now look at the picture. This is heart. On the heart there is the presence of cardiac plexus. From the cardiac plexus efferent fibers emerge. Some fibers enter into the vagus nerve. So these are the cervical and thoracic cardiac branches of vagus nerve, and some enter into these are again the cervical and thoracic cardiac nerves which enter into the sympathetic ganglion. Clear? So some cardiac nerves enter into the vagus nerve, and some visceral efferent fibers enter into the sympathetic trunk. Those that enter into the vagus nerve mainly are concerned with the cardiac reflexes, and those that return to the sympathetic trunk they conduct pain sensation from the heart. So these are the references.